So the study that we talked about today had to do with the essential impact of social determinants of health on outcomes and access to allogeneic transplant, which is the only potentially curative therapy for patients with acute myeloid leukemia. What we looked at is actually the association between specific social determinants of health and several outcomes that included mortality or risk of death without transplant or before patients undergo transplant, actual access to transplant, and then mortality after allogeneic transplant. And so what we found was specific social determinants of health do play a role, significant role, in both access to transplant as well as risk of death without transplant. However, they play less of a role once patients receive transplant. So again, highlighting the fact that the patients who are able to overcome the barriers to access, they can do potentially comparable to patients from other socioeconomic backgrounds.
What's unique about this study, it's a prospective study that started from the diagnosis of acute myeloid leukemia and followed patient for 2 years afterwards. And what makes it unique is we collected large number of data that tell us information about patient health and about acute myeloid leukemia risks. Because in the past, people will say, well, if some people from underrepresented minorities or low socioeconomic factors are not getting the transplant, maybe because they are too sick or have so many medical problems. But the study shows that even after we took into account these parameters, the socioeconomic factors still were barriers, increased mortality, as Dr. Wuliji just said, and decreased access to transplant. So the unique aspect of the study is we took into account those medical variables and still the social factors had an impact, which tell us it's not really a medical problem, it's a social problem that we need to resolve.